Hi there, this is Bholenath Tamrakar and I welcome you all in the classes of Easy Pharmacology. Today my topic to discuss is urinary tract infection. Urinary tract which filter the blood and forms urine. To filter the blood it need pair of kidney where kidney has some minute functional structure named nephron. That nephron gets supply of porous blood vessel. By using it, it filters the blood and forms urine. Once the urine is formed, it gathered by those pipes called ureter and stored in the urinary bladder. When urinary bladder is filled fully, then it releases the urine by using urethra. That is all about urinary tract. Once it gets infected by pathogen, it considered as urinary tract infection, in short UTI. 90% cases of UTI covered by Escherichia coli, where remaining 10% by Enterobacter, Klebsiella, Pseudomonas and Proteus. To infect the urinary tract, a pathogen has to enter inside the urinary tract. There is one way to entry is by using blood. In case of it is called hematogenous infection. Second way by infect the urethra and then moves up to cover whole the urinary tract. To move up we use the word ascend and such type of infection is called ascending infection. Ascending infection is more common in female rather than male because female has shorter length of urethra. Move again, the upper part of the urinary tract considered as upper urinary tract, hence infection called upper UTI. Similarly, lower part, lower urinary tract and its infection is lower UTI. That lower urinary tract has to deal with urine only. It gathers it, it stores it, it releases it. So if it infected, the symptoms appear alike to the urination, like burning while urination, and increase the frequency of urination, increase the urgency for urination, blood cell availability in the urine, then urine with strong odor, then pelvic pain in case of female and rectal pain in case of male. In case of ascending infection, urethra is the prime organ which get infected by those pathogens. Those pathogens infected, then inflamed also. For the inflammation, we use the word itis and that itis combined with urethra and become urethritis. Urethritis usually caused by Neisseria gonorrhea, then we called it gonococcal urethritis. If it caused by E. coli, then we called non-gonococcal urethritis. Urethritis is more severe if it merge with bladder infection also. Alone infection of the bladder considered as cystitis and cystitis is more common in case of immunosuppressed person because it caused by Candida albicans like fungus. Then move towards ureter where pathogen has to infect it. Again infection, then inflammation. For the inflammation we use the word itis and combine it with ureter and it becomes ureteritis. Ureteritis is usually mild in nature. If infection repeats or stay longer time in the body, it becomes chronic one. Now move to the upper part, then upper urinary tract infection. If kidney get infected, we use the word pyelonephritis. Pyelonephritis is combination of two separate words. Pyelo means renal pelvis, where nephritis is inflammation of the nephron. And whole word become pyelonephritis. If pyelonephritis is acute in nature, then it causes pain and tenderness in upper back and sides, sometimes chills, then fever and nausea and vomiting also appear in the patient. If pathogen attacks again and again, then it turns to chronic pyelonephritis. And chronic pyelonephritis justified by two separate causes. One of them is disturbance in micturition, where micturition says movement of urine from urinary bladder to urethra. If pathogen attacks on it and opposes the flow, it turns back towards the ureter, that is called reflux and causes reflux nephropathy. Reflux nephropathy again develop into chronic pyelonephritis. Second side, urine has to move from kidney and following the ureter, it has to move out from the urethra. If pathogen attacks it and block the pathway at several steps, it called obstruction and causes obstructive pyelonephritis. It is all about urinary tract and those pathogens who infect the urinary tract. If pathogen invasion is higher, then we have to use sulfonamide and quinolones like antibiotic. Life of a bacteria depends on some primary molecule like para-amino benzoic acid PABA, which turn to dihydrofolic acid. Upon reduction, it forms tetrahydrofolic acid, and the tetrahydrofolic acid is so important for the purine synthesis. Purine is a kind of a nucleotide which has to participate in DNA synthesis. And here sulfonamide, which has structural similarity with para-amino benzoic acid, hinders the pathway at initial stage because it incorporates itself in that pathway and blocks the reaction at initial level. Trimethoprim is other kind of drug which target the reductase enzyme and stop the formation of tetrahydrofolic acid. And combination of both the drug is so strong to control the urinary tract infection. That's why their combination trimethoprim and sulfamethoxazole available in the market. Move towards the growth. For growth, bacteria need DNA synthesis, and the DNA synthesis depend on DNA gyrase and topoisomerase likewise enzyme. Those enzymes cause negative supercoiling. Negative supercoiling means unbound the DNA. Once you unbound the DNA, it is available for the replication and may bacteria grow again and again. In such case, quinolone target DNA gyrase and topoisomerase enzyme and stop the negative supercoiling to perform strong bactericidal action. To control urinary tract infection, initially we use antibiotics like sulfonamide, sulfamethoxazole and sulfadiazine, quinolones, norfloxacin and ciprofloxacin. Apart from it, we use some antiseptic like methenamine, nitrofurantine, and to control the pain, we use some analgesic agent like phenoxypyridine. The mechanism of action for phenoxypyridine is not clear, but methenamine is a kind of prodrug which hydrolyze and produce formaldehyde. If urine is acidic, then it produces more formaldehyde. The more formaldehyde is there means more bactericidal action is there. On the other hand, nitrofurantine interact with bacterial flavoprotein and reduce itself. Upon reduction, it generates reactive intermediate, and that reactive intermediate targets bacterial ribosomal protein and inactivate it or alter it. So they are the drugs which I covered for you as antibiotic, antiseptic and analgesic to control the urinary tract infection. At last, I want to put my thanks to Dr. Shamim Qureshi sir and Dr. Jitendra Patel sir for their generous support to create this video. Thank you sir, and thanks for watching us. Please like, share and subscribe it for more videos. Thank you.